Yeah. Hi, my name is Ria Lobarbio-Smith, and I'll be presenting about the substance use disorder and specifically alcohol use disorder. Substance use disorder or alcohol use disorder. I'll be talking about the introduction to alcohol use disorder or AUD, history of AUD, its prevalence and epidemiology. AUD, according to DSM-5 criteria, risk factors, and then the short term and the long term effects of AUD, the signs and symptoms of, of alcohol use disorder, and the evidence based treatment plan, both for pharmacological and non pharmacological treatment, and then the conclusion. Uh, the introduction for alcohol use disorder. Um, Alcohol is an alcoholic drinks or beverages consist of ethanol, which is a psychoactive and toxic compounds capable of leading to dependence. And the consumption of alcohol has been identified as a causal factor in over 200 diseases, injuries, and various health conditions. And there is no type of alcohol consumption that is entirely without risk. Even minimal levels of alcohol intake come with certain dangers and can lead to no harm, or it can lead to harm. The history of abuse in the US, the history of alcohol abuse in the United States is extensive and intricate. It's transitioning from a commonly accepted social practice to a significant public health issue. At first, alcohol consumption was prevalent and even deemed necessary for both social and health purposes. However, shifting attitudes and heightened awareness of its adverse effects prompted social reform movements and eventually led to prohibitions. Although prohibition lifted, alcohol abuse continues to be a major concern, with persistent initiatives aimed at tackling its effect on individuals and society. The prevalence and epidemiology in the USA, according to in 2023, according to National Survey on Drug Use and Health, uh, 28.9 million individuals from ages 12 and older, which is 10.2%, had AUD in the past year. This includes 16.8 males or 12.1% males of 12 years old and older, and 12.1 million females, which is 8.3% females year 12 years and older. Although AUD or alcohol use disorder affects all individuals, but it is much more prevalent on ages 18 to 22 years old. And interestingly, even though it's very prevalent in our country, a good number of individuals who met the criteria for AUD do not receive treatment. So, what is substance abuse disorder? The hallmark of substance abuse disorder are behavioral, physical, and psychological dependence. And behavioral dependence, the emphasis is the substance seeking activities and related evidence of pathological patterns, while the physical dependence is that the physiological effects of multiple episodes of substance abuse, and the psychological dependence, which is the habituation or continuous or intermittent craving. So, what is alcohol use disorder? It is a medical condition characterized by impaired ability to stop or control use, despite of adverse social, occupational, or health consequences. And it encompasses the condition that some people refer to as alcoholism, alcohol dependence, alcohol addiction, and alcohol addiction. AUD is characterized by combination of or cluster of behavioral symptoms such as withdrawal, tolerance, and cravings. Withdrawal are symptoms developed in 4 to 12 hours after decreasing intake following a prolonged drinking, while tolerance is a diminished sensitivity of the effects of the alcohol to the body following repeated exposure. And cravings is a strong desire to drink and makes it difficult to think anything else. So AUD, according to the DSM-5 criteria, wherein the symptoms occur within 12 months, it consists of this uh, two of the following symptoms. And also, there is a marked impairment or distress in the individual. So, what the at least two symptoms are the following: the physiologic symptoms, which can manifest as alcohol tolerance, withdrawal, or the symptoms typical of addiction or obsessive use, such as craving to use, using more than intended, difficulty stopping or reducing, spending significant time devoted to the substance, and use despite acknowledging health problems. The, and there is also a psychosocial sequelae of use, which using despite social, occupational, or other adverse consequences, and the individual neglecting other responsibilities or other activities because of use. And there is also a risky or dangerous behaviors or situations because of use. As I mentioned, according to DSM-5, uh, to qualify for alcohol use disorder, the patients must have two or more of the previous symptoms and within 12 months period, and there is a marked impairment or distress in the individuals. What are the risk factors for AUD or the um, vulnerable populations associated with alcohol use disorder? It could be drinking at an early stage or age, genetics and family history of alcohol problems, and mental health condition and history of trauma. Researchers Research shows that among people of ages 25 and older, those who become drinking before age 15 were more likely to report having AUD in the past year compared as to those who waited until age 21 or later to begin drinking. The next one is the genetics. uh, Research had shown that genetics play a role with hereditability accounting for about approximately 60%. However, just like other chronic conditions, AUD or alcohol use disorder can be influenced by both genes and environmental factors. And also, parents' drinking patterns may also influence the likelihood that a child will also develop AUD later in life. The other risk factors is also mental health conditions such as depression, PTSD, and attention deficit hyperactivity disorder are comorbid with AUD and increased risk of alcohol use disorder. Also, people with history of trauma or childhood trauma are also vulnerable to AUD. So, what are the short-term effects of alcohol use disorder? It could be increased accidents and falls, nausea and vomiting, decreased inhibition, hangover, interpersonal conflict, and alcohol poisoning. The Now, what are the long-term effects of AUD in the body? Almost all major organs of our body are affected by alcohol use disorder. Since alcohol interferes with the brain's communication pathways and can affect the way the brain looks and works, this disruption can change mood and behavior and make it harder to think clearly and move with coordination. Uh, Also in the brain is also can increase the risk of stroke. It can also give peripheral neuropathy, also increase the different types of cancers such as liver, breast, esophageal cancer, and throat cancer. It can also uh, give patients pancreatitis, also cardiomyopathy, increased risk for myopathy, and increased risk of infection. What are the signs and symptoms of abuse upon assessment? Um, it could be as according to the DSM-5, what we that I had already uh, presented before, and the symptoms can be mild, moderate, and severe. Mild is the presence of 2 to 3 symptoms. Moderate is the presence of 4 to 5 symptoms, and severe is the presence of 6 or more symptoms. So we will just have to go back to uh, the criteria set by DSM-5 for the alcohol use disorder. So again, patient can fail to limit uh, the patient failed to limit the amount of alcohol in an individual drink, the individual wanting to cut down on how much to drink, or the individual is making an unsuccessful attempts to do so. Also, that person invests in a considerable amount of time in drinking, procuring alcohol, or recovering from its use. And there is also an intense cravings and failing to meet significant responsibilities at work or school or home due to recurrent alcohol consumption. And the other is a persisting in alcohol consumption despite of awareness of its detrimental effects on physical, social life, work, or relationships, and abandoning or diminishing social and professional engagement and habits in favor of alcohol use. Also, consuming alcohol in hazardous situations such as driving or swimming, and developing tolerance to alcohol, necessitating increased amounts to achieve the desired effect, or experiencing diminished effect from the same quantity. And those patients that suffering from withdrawal symptoms, including nausea, sweating, and tremors, when abstaining from alcohol or drinking to alleviate these symptoms. What are the potential overdose or use as suicide um, of choice? Studies from 1999 through 2014 on different countries, including the United States, that intoxication and chronic alcohol use are associated to suicide. In fact, the meta-analysis studies from 1996 to 2014 concluded that acute use of alcohol consumption is related to 7 times increased risk of suicide attempt And this also showed dose response association between alcohol levels and suicide risk. So, what are the different care plan for uh, alcohol use disorder? Um, as with many other medical conditions, treatment for alcohol use disorder is not one size fits all. Different patients may need different options. Fortunately, there are more AUD treatment and choices than many people may expect. Evidence-based quality treatment is offered on different levels, and it could be pharmacological or non-pharmacological use. There are three medications that are approved by the FDA for AUD. The first one is naltrexone, and then the acamprosate, and then the disulfiram. Naltrexone is available in oral or injectable extended release. It works by blocking the opioid receptors in the brain that are involved in the rewarding effects of drinking alcohol. And then this pill can be taken orally or injectable. And the pills is taken once a day, whereas the injection is given once a month. And this can be started while patient is drinking. The other medications that can be prescribed is the acamprosate. This helps to maintain abstinence by acting on the glutamatergic neurotransmitter system to alleviate the emotional discomfort of anxiety, restlessness, dysphoria, and insomnia that can happen as the brain adjusts to abstinence. And you can give 2 tablets 3 times a day of acamprosate, and it could be initiated as soon as possible after withdrawal when a patient has achieved abstinence. The third one is the disulfiram. This drug interferes with alcohol metabolism by blocking the enzyme dehydrogenase, causing a buildup of acetaldehyde that leads to flushing, nausea, and other unpleasant symptoms when alcohol is consumed. It is a pill taken once per day that help patients maintain abstinence. But uh, the important thing to remember when we are prescribing the sulfuram is it should never be administered until the patient has abstained from alcohol for at least 12 hours. And these three drugs are non addictive and can be used alone or in combination with non pharmacological therapy. Now, the non pharmacological therapy can be the different modality of therapy, like CBT or the cognitive behavioral therapy, and then the MAT or the motivational enhancement therapy. CBT focuses on identifying and managing the thoughts, feelings, situation, behaviors, and stressors that lead to heavy drinking. The goal of the CBT is to change uh, negative cognition and behavior and develop skills to cope with situation that triggers that might result in urge to drink. The other uh, therapy is the MAT, which is conducted over a short period of time to help people build their own motivation for changing their drinking, uh, form a specific plan for changing drinking behavior, and develop the skills and confidence needed to stick the plan. Um, we also have to educate the patient, inform the patient regarding Alcohol use disorder is a medical condition that can be treated rather than the reflection of moral weakness. You can also discuss or educate the patient about the potential consequences associated with alcohol use, such as its adverse effects on the body and social consequences. We have to educate the patient also on the withdrawal symptoms and when to ask for help. We also have to inform the patient about the different treatment options and teach the patient coping strategies to manage effectively the stress or triggering factors. Referral, um, patient also can be referred to a mental health specialist for psychotherapy, and the patient can be referred to a special group like a support group such as Alcoholic Anonymous. Or we can also inform the patient about telehealth resources for easy access. And also the crisis intervention. We get, we have to provide emergency services, information about emergency services or government agencies that deals with AUD, such as the SAMHSA helpline for urgent situation, or even the suicide helpline in case of suicidal ideation, or the 988 suicide and crisis lifeline. And if necessary, uh, we can refer to inpatient treatment, especially for those who have severe symptoms or alcohol withdrawal. The follow-up for AUD, this consists of regular follow-up visits every 2 weeks of initiating a treatment, then monthly and quarterly as the treatment progresses. And through the follow-up, we have to monitor compliance to medications, its adverse effects, and the signs of possible relapse or continued alcohol use. And through the follow-up, also, we have to reassess the treatment plan if it's effective or not. In conclusion, many individuals successfully recover from alcohol use disorder. Nevertheless, setbacks are common for those in treatment. Seeking professional help early on can prevent return to drinking. Both pharmacologic and non-pharmacologic approaches, which are evidence-based treatment, can be employed to support individuals in achieving a successful recovery. Thank you.